Good afternoon. Thank you for coming out today. We appreciate you all being here. I'm joined today by my colleague, Ted Dabrowski, who's our Vice President of Policy at the Illinois Policy Institute. My name's John Tillman. I'm the CEO of the Illinois Policy Institute. We've just returned from Springfield, where we held a press conference today to present our Budget Solutions 2014 and also our pension reform proposal as well. We were joined in Springfield by Representatives Morrison, who's the sponsor of the bill, along with Representative Jeannie Ives, Representative Dwight Kay, as well as Senator Kyle McCarter. We were happy to have all of them with us this morning. Of course, the General Assembly is in session, so they could not be here with us this afternoon. As I've noted, we are releasing our 5th annual alternative budget, Budget Solutions 2014. Our budget proposal takes a very balanced approach to the very, very large problems facing the state of Illinois. There are 3 groups that all have a stake in the solutions we eventually find to put our state back on the right track. Those 3 groups begin with public employees, people who work for the taxpayers for a state or local government or an educational organization such as K through 12 or our university system. Their retirement plans are in a state of crisis, and as Dick Ingram from TRS has said, they will soon run out of money if not reformed. The second group that has a stake in the solutions we find, of course, are people who depend on government services, particularly the poor and disadvantaged, whose services such as Medicaid are being crowded out by the growing pension payment every year. Whether you care about education funding for the poor in tough neighborhoods in Chicago all across the state, higher education learning, health care services for the poor, or Medicaid funding, all these programs are at risk because pensions have not yet been reformed and the pension payment is growing every year, projected to rise to $6.7 billion next year. And of course, the third group that has a stake in how these things are solved are the taxpayers. The taxpayers pay for everything that makes those first 2 groups services and paychecks and benefits possible. The taxpayers of Illinois pay the 9th highest overall tax burden in the country on a per capita basis. And in addition to that, they've just had 2 weeks of their pay over the last couple of years taken from them, first in the January 2011 lame duck tax hike here in Illinois, and most recently in January when the payroll tax resumed at 2% higher than it was before. So all 3 of these groups have a stake in what was the solution ultimately is found. Unfortunately, all the proposals so far to date and over the last 4 years have not solved our problem. We worked very closely, as I've noted, with Representative Morrison to craft this pension reform plan, and we worked very closely with Representative Jeannie Ives on a variety of our budget solutions, broader policy proposals. None of these choices are easy for any of those 3 groups I've mentioned. They all require sacrifice, and they all require great leadership by people in Springfield, and that's why we're so proud to be working with Representative Morrison and Representative Ives in particular on this. The pension crisis is the biggest thing facing the state. My colleague Ted Dabrowski, as I mentioned a moment ago, will be addressing the pension part of this proposal in some detail. Our problems are huge, however, and pension reform alone will not solve the problem. That's why our annual budget, alternative budget solutions, attacks spending, structural overspending in a variety of ways that are very important to concentrate services on those most in need. We concentrate services more directly on those below the federal poverty level in Medicaid reforms, overall health care. We ask for state workers to take some stake in the game with employee compensation. We've looked at revenue sharing, state grants to nonprofit organizations, retiree health care, and much more. Altogether, this puts us on a path back to prosperity. Most importantly, it puts us on a path to try to climb out of the 50th place we are in overall economic performance and start competing, moving up the scale once more. What our proposal does overall is really quite amazing. It balances the budget. It allows the tax hike not just to sunset as scheduled in December of 2014, which is a partial sunset, but be fully repealed by July of 2014, returning $7 billion to the taxpayers. It concentrates core spending on those areas most in need in a balanced approach, as I've discussed. And perhaps most amazing of all, it actually pays down the $9 billion in unpaid past due bills by 2016. Nobody else is putting together a proposal that's comprehensive and solves all these problems. And clearly it won't be easy. It is a very tough political lift. But we're putting a marker out there that we believe all other solutions should be measured against. And the biggest solution, of course, is the pension proposal. Ted Dabrowski will give you some details on that. Ted?
Thank you, John. I'm Ted Dabrowski, the VP of Policy at the Illinois Policy Institute. And as John mentioned, we have a very ambitious plan to reform pensions. Our goal is not to create just a savings in the next few years so that we can find a way to fix pensions in the future. Our goal is to fix it now. What I'd like to do is tell you about 5 key elements of our plan. First of all, for any plan to be successful, it must cut the unfunded liability massively. Our plan does that. It cuts the unfunded liability from nearly $100 billion to nearly $50 billion, about half. There's no way to fix Illinois unless that debt overhang is gone. Number 2, our plan stops the uncontrollable growth in unfunded liabilities. It's not enough to just cut it. We have to stop its growth. And the way we do that is by eliminating the defined benefit plan that has been in place in Illinois for so long. The defined benefit plan is the root cause of the problem in Illinois. The defined benefit plan is uncontrollable, it's unpredictable, and the reasons why is because politicians and the fund managers can't predict what investment returns will be in the future. They can't predict what increased benefits politicians will give away, and it certainly can't predict mortality rates and other assumptions that go into a defined benefit plan. And that's the reason why 85% of the private sector has moved away from the defined benefit plan. So we propose to do that. Number 3, our plan eliminates the irresponsible pension ramp. For those of you who don't know what the ramp is, it's the way that our state repays all that debt. What they do is they have lower payments today and massive payments in the future. What they do is they push off the debt onto our future generations, our children, our grandchildren, at the expense of today. What I want to show you What I want to show you on this chart, this is the original Edgar ramp. The black line on the bottom is the original Edgar ramp. In 1994, he came up with a plan, and this was the plan to solve pensions in Illinois. This was a plan to repay the debt over 50 years. But just here we are in 2013, and now those projected payments are much, much higher. If you look at the red line shows where those payments are now. The difference between the original projection in 1994 and the amount that we're required to pay through 2045 based on today's numbers is $105 billion difference. That means that taxpayers are going to have to pay, if we stay with the current plan, at least $105 billion more than was originally proposed. That is unsustainable. And any plan, any proposed pension plan that continues to have a ramp and continues to depend on the defined benefit system will have this exact same problem. Nobody with that kind of plan can guarantee that this won't happen again. So we must end the payment ramp, and we must end defined benefits. Now, in our plan for the 4th element, if we're going to end the defined benefit system, that means we're going to move towards something new. And going forward, we're going to offer a defined contribution plan for all employees, all current workers. What we do is we're very careful to protect the constitutionally guaranteed benefits already earned by current workers and retirees. But going forward, we put the workers back in control of their own retirements. And we take the control of retirements away from the politicians that have created this problem and this massive unfunded liability that we have. So it's important that we protect the benefits of the past. That's very important. But going forward, we need a new plan. And both of those combined together make sure that there's a sustainable retirement system for our system. Now, it's very important. There's a lot of I'm sorry. There's always skepticism about moving to a 401k plan, but what we wanted to show you is a simple example of how powerful our proposal is. This is an example of a teacher who starts at the age of 25 with a starting salary of $35,000. If we assume that that teacher gets average raises of just 3% per year, which we know in the public sector they tend to be higher, if we assume that they get investment returns of 4% a year, which is half of what the teacher's retirement system expects today, and what we do is we create a 401k style plan where the employer contributes 7% of that teacher's salary every year, and the employee contributes 8%. By the time that teacher is 67, that teacher will have amassed $1 million in retirement savings in their 401k style plan. And at that moment, that teacher could buy an annuity for the rest of her life and receive $54,000 a year. That is a plan that is quite sustainable and that only assumes a 4% investment return. So if those investment returns are higher, they will have much more. So we believe that that 401k plan is a stable plan. It's a very generous 7% match by the state, and it's definitely a sustainable retirement for workers. And one, they would no longer have to depend on the promises and guarantees of the state government in a defined benefit system that has been failing them all along. The last thing I want to say, the fifth element that our plan does not have, that other plans do have, is that no plan should have a guarantee, funding guarantee in place. There's proposals out there that say that any pension plan must have a funding guarantee. The problem with that is that that would put funding pensions of state workers ahead of the education for our children, the health care, public safety, roads, and we can't have a society and a system that puts a special guarantee on pensions over and above those core services of our government. So that must be removed. In summary, what our plan does is, you'll see on that final chart, the higher bars are the current law payment requirements that the state must make through 2045. And what you'll see is that that's the ramp. The state will have to contribute more and more money to the pension system at the expense of all other core services. And that number ramps up to $17 billion by 2045. Our plan is the bottom in the green. Our plan ends the ramp. It makes the pension payment sustainable. We can have a focused budget, a budget that's sustainable. And as well, as you can see, over time, it takes a smaller and smaller percentage of the overall budget. That, in summary, is our plan, and we'd love to answer any questions you may have. Thank you.
Explain to me how it immediately does that.
First of all, our plan was scored on the TRS system by COGFA. COGFA is the Commission on Government Forecasting and Accountability. They're the official score of these things. We then took that information from the TRS system and extrapolated that to the other systems that we report here. The way it was done is the core drivers of the unfunded debt are retirement age and COLAs. And so what we do is, like all the other proposals, is we freeze COLAs until such time when the systems are healthy again, and that makes a massive difference in the unfunded liability. The second thing we do on a scaled basis is we raise the retirement age so it's matching what the taxpayers live with. The taxpayers retire at 67 to be eligible for Social Security. We think there should be equity and justice between the taxpayers who pay for this and the workers. Right now, most workers can retire at 55 after a 30-year career. And so what we slowly do over time, if they're near retirement, we do this a little bit. If they're early in their careers, then we ask them to work till they're 67. And moving that retirement age over the course of the next several years also is a big reason you can reduce that unfunded liability. And those are the two major ways we get it from. The projection is $101 billion in 2014, brings it down to $55 billion. Then, as you can see over here, we pay it off over time on a flat line basis. Ted, is there anything I missed on that?
Yeah, I just want to add that also, starting tomorrow, if we were to execute the plan today, we would no longer be accruing more defined benefit liabilities. Right. And so therefore that stops that growth.
So the calculation, the fuzzy math, is COGFA's fuzzy math, and we love COGFA's fuzzy math because it's accurate and based on the actuarial assumptions. And of course, COGFA is also the same group that is scoring the Cullerton bills, scoring Neckrets-Biss, scoring Cross, Neckrets. Everybody's trying to come up with a solution, and this is the only one that actually reduces that unfunded debt by the amount. I think they're talking about $30 billion reduction. Obviously, we're talking $46 billion. And the bottom line is, unless you bring down the unfunded debt, you can't fix the problem going forward, and you have to convert to a 401k.
So 2045 is the end date then?
End date in terms of being fully funded would be zero for us. Remember, the original Edgar ramp in 95 said 90% funded by 45, which of course is sort of silly. It's sort of like, to put this in terms we can all understand if you have a mortgage, it's like paying a little bit of your mortgage now, but having your mortgage payment go up every year and consume more of your household budget. That's what the ramp did, and that's what it does. What we're saying is we should do it the way we actually all pay our mortgages, a steady payment every month that you can plan on. Then over the course of your career, if you're paying a mortgage, hopefully you make more money and that mortgage payment consumes less of your income. That's what we're doing here. We're saying a flat line, and as natural revenue growth occurs, that $4.7 billion flat line will become a smaller and smaller portion. If we leave the ramp in place, the ramp and that payment becomes a Pac-Man, and it's swallowing core government services and preventing people, for example, from getting health care through Medicaid right now, and especially people who are below the federal poverty line, and we think that's the tragedy of it.
A lot of the politicians, their problem with some of these plans is that, well, they haven't been, let's call it vetted yet. They haven't been, but because you're using COGFA's numbers, you're confident that this, would be something that they'd be receptive to.
Yes, well, reception and confident are two different things. I'm very confident that it's been properly vetted because COGFA is the gold standard on this, the official government entity that does that, and then we put our, as I said earlier, our calculations on top of their original work. So they are the ones that have access to the actuarial tables and can figure out how it plays out over time. All the plans that have an official number on their impact on the unfunded liability do that, but none of them come remotely close to what we've done here because we've been the most aggressive in taking on the core drivers, and everybody else, frankly, has been reluctant to do that.
What about the medical benefits for retirees? Does that play at all into how
Yes, it absolutely does. That's part of our larger budget solutions proposal, and it's, I believe, $684 million that we save by asking current retirees and future retirees to pay more for their health care. In most states around us and around the country, retirees pay about 50% of their health care cost. For government workers in the private sector, generally speaking, they pay 100% of the retirement costs. Here in Illinois, they're paying from 0 to about 9% currently. So what we ask people to do on a sliding basis based upon income and age is pay more of their share to help us get to where we need to be, and it saves about $684 billion. So somebody who has low income and is retired, a little older, they're going to get a greater subsidy and not have much impact at all. People who have high income, because remember, a lot of people who retire in their 50s or 60s take on another job and have income beyond their retirement. So what we're asking those folks to do, have good household income, is to pay up to 50%, and it's a sliding scale so that it's equitable across income levels and age.
And what about cost shift that
The beauty of what we've done here, cost shift is very important from a philosophical point of view. We believe that every unit of government should be accountable for its retirement costs for its employees, since it hires them, it pays them, and the pay sets this retirement scenario going forward. We think everybody should be accountable for that. But what our program does is it makes certain what that cost is going to be. So in the 401k side of this, the employer share, employee puts in 8%, the employer puts in 7%. So the local school districts or local units of or state government and the other entities involved in this all know their cost is going to be 7% of payroll. If we do other programs that are out there being recommended that leave in place defined benefit, even if you did a cost shift, because defined benefit, as Ted has well pointed out, is so volatile and unpredictable, they don't have certainty. And so we give them certainty. The overall cost, one of the great myths is that this idea of local accountability would be a big explosion on property taxes for a school district. That is a myth. We've looked at the numbers, dove into them deeply with straight math, crystal clear, and it's on average about 3% cost to local school districts. And we think obviously that's something that they can absorb, and then of course over time that will shrink as their budgets go up over time.
So there's definitely the shift from, I mean, I understand what you're saying. This is a set number, so they know what they got to plan for, they know what they do, but it would definitely shift the cost of paying for a teacher's pension to that local unit.
Only of the employer share of the 7% of their payroll cost. And that is fixed then. That's a known number. If you leave in place the current system or any of the other proposals on the table, that leaves in place the volatile defined benefit that also they're talking about shifting, but they're talking about shifting in a way where it's going to be unpredictable and we think more risky for local school districts. What we want to do is create predictability. That's what all this is about. Reduce the overall unfunded liability, create predictability so budgeters can plan accordingly. That was fun. I'm so glad you asked those questions. Anybody else? All right, thank you.